Hello, everybody, and welcome. And today I'm very pleased to introduce Doctors Donald Moss and Angel McGrady, who have come to talk to us about their book called Pathways to Long-Term, Pathways Through Long-Term Health Conditions. And I obviously was immediately struck by that, as obviously our audience and our community is very much based around those with chronic health conditions, and that we all know that it is, you're in for it for the long term. Even if, you may be having time off from it, and you're doing well, and then suddenly you have a setback. And I was really intrigued to read this and understand. And I honestly, I have to say to you, I think anybody that has a long-term chronic condition should get this book and read it, because I think it can help anybody at whatever stage you might be. You either just embarking, just got a diagnosis, or you for many years have had a long-term condition and thinking, what else can I do to support myself and improve my welfare? So welcome. To kick off, I'd like you both, perhaps Donald, you'd like to start off just giving a little bit of background of yourself and how you came to, well, actually, it'd be interesting to know how you both came to co-write a book.
Well, thank you for having us today. Again, I am Don Moss. I'm the Dean of the College of Integrative Medicine and Health Sciences in Pasadena, California. I've been interested in long-term health conditions throughout my entire career. Way back in the 1970s, I did an internship at the University of Pittsburgh for part of my clinical and health psychology training. And my placement was in a psychosomatics clinic. Patients had medical symptoms, but they also had a lot of emotional involvement with their illnesses. And I became intrigued. I was trained originally simply to sit and listen to the patients, and that was interesting. They felt understood, they felt supported, but it didn't really help them a great deal with their symptoms. So in the course of my career, I've become interested in how do people develop chronic illnesses, and then what can they actually do? Another learning experience for me was about 10 years I spent with the Multiple Sclerosis Society in Michigan, where I actually live now. And I had a self-help group and I facilitated, and I had these wonderful people who came to me and they had a chronic illness that came and went, got worse, got better. But many of them somehow managed to live very full lives. They went camping, they went traveling, they were part of book groups. They did a variety of things that kept their life to full and interesting. So I became interested, which led to my collaboration with Dr. Angel McGrady, and I'll let her introduce herself.
Yes, thank you. Thank you for having us this morning, this afternoon. And we appreciate all the people that decide to tune in, and hopefully it'll be beneficial and instructive to them. I am Dr. Angel McGrady. I'm a professor in the Department of Psychiatry at the University of Toledo Medical Center. And my pathway to this point has been different than Don's. I started out in basic science and physiology, and then later on connected the mind with the body. And that led to my interest in helping people with chronic illness who also have emotional problems. And what was instructive to me and how we came to write this book is, sitting in a room with people who were already receiving high level of medical and psychiatric care, and they were still sitting in my room needing help. So that led to my starting to understand that even though they were getting high level medical and psychiatric care, they were missing the basics. So they were not controlling their own breathing. They didn't feel in any way in control of their illness. And so going back to the very beginning of learning how to regulate your breath, learning how to slow your heart rate, learning how to relax your muscles was where they needed to be. So not everybody needs to have high-level medical care, and sometimes even though you have it, you're still not well. So we got more and more interested in well-being and whatever it would take to get there. Second thing is giving people more control over their own health. So suggesting leading them to self-care activities and self-enhancement activities that they would then use to better their health.
Thank you. So I think what would be a good idea, so if I just quickly explain, for me, the book is made up of this methodology, for want of a better word, or pathway to how to improve your health. And it is an integrated look. And I think one of the things that I think it said in the book is like you'll see somebody as a whole person and not just a series of diseases. And it's very much, as you said, Angela, is very much looking at everybody. And I know we come to something called healing themes, which we'll explain later on, but it's looking at it from all the way round. And it's a way to enable you to do something, almost if you wanted every day, a little something to move forward in better health. And I want to say better health because I think that anything that you can do to improve your health, which is what this encourages, is towards to better health. Now, the book is very much divided into, Donna, we'll ask you to talk about the three sort of levels of pathways. But having told everybody about how that works, it then moves on. And I think it's great because it covers a whole range of different conditions from, the main ones, which are always the sort of headlines: diabetes, cardiovascular, and cancer, through to more, I don't want to say everyday things such as the headaches, IBS, arthritis in hands. And I love the way honestly, the subjects that you've chosen, which are so, oh my God, everybody's got them one way or the other. Pick 10 people and somebody's going to have at least one of those conditions. And then you look also at how your methodology works with other things, which is underlying depression, anxiety, PTSD, which are the things that either you may have them or they've come about at the same time as having a condition, as to, maybe what comes first. And that's what I think is so great about the book. It isn't saying, take this and you will, if you've got diabetes, this is what you should do. It is not a medical book like that. It is more about how do you look after yourself when you have a condition and how to progress. For goodness sake, I've done a lot of chatting there. If I've got any of that wrong, please just tell me. So, Don, if you'd like to kick off, just explaining what the pathways are.
Okay, thank you. Well, first of all, I do want to emphasize, and I think you've said this, but this is a self-help book for the individual, the person who's struggling with a long-term condition. They might use it with a counselor or a health coach, but they might also use it entirely on their own to guide their own self-help. The idea of pathways has come out over a period of years for Angela and I. We've written 2 books for professionals. Our emphasis is that there are negative behaviors that each of us has that we engage in that tend to make us vulnerable to illness. And once we have an illness, whether it's diabetes or high blood pressure or anxiety, some of our behaviors will make that condition worse at times. So the Pathways model addresses these behaviors and asks people, let's do an assessment. Let's look at 10 different areas. Everything from how are your emotions now? How is your thinking at this time? How active are you? What's your nutrition? How's your sleep? 10 different areas. So we look at those areas, we identify gaps, areas which are a problem. And for some of our patients, they might be very strong in the nutrition area, but their emotions are a mess. So we identify areas that are problems, and then we address things in 3 steps. Level 1 is some small self-directed changes. What can you do right now? Maybe you've been sitting in a chair because it hurts to move. So step 1 might be to walk to a nearby park 2 city blocks away. Or for a person in a rural area of the United States, oftentimes our mailbox is 150 feet from the house, and walking to the mailbox may be a small step. Angel referred to breathing. We teach most of our patients to engage in paced diaphragmatic breathing, breathing slowly, gently, comfortably, and quieting the mind, quieting the body, enhancing our spirit. So it's mind, body, spirit. What are some small steps we can do? Level 2, we begin to get into acquiring skills. There are a variety of skills that we can teach. We can teach mindfulness. How can we live in the present moment, accepting and becoming aware of whatever is happening in this moment without judging, without criticizing ourselves about it? That's a skill. We might learn that by just giving the person a paper handout, something they can read, or we might tune them into a YouTube video that's available online. Or as some of my patients, find a community resource. We have community centers that often have a mindfulness class. So the patient will attend that mindfulness class and learn some skills, but also discuss them with other people who are struggling as well. Other skills, progressive muscle relaxation, learning to relax your entire musculature and to become aware of the tensions in your body. Guided imagery. Imagery is so powerful. Picturing myself in a soothing, comforting surrounding. So just basic skills. Level 3, we move on to working with professionals. And when I say professional, it runs the gamut. It might be your general physician, for some kind of medication to make it possible for you to tolerate the activity more. Or it might be an alternative therapist, a Reiki healer, an energy healer, a nutritionist, exercise physiologist, pastoral counselor. Some people living with a chronic medical illness have spiritual struggles. They think, what did I do to deserve this? How did I bring this on myself? And talking with a spiritual guide may be helpful, or learning simple spiritual practices like meditation. Meditation can be so powerful. So that's level 3, working with professionals, but continuing to do level 1 and 2. If I found that breathing gently and a paced breathing, if that was soothing for me, I might want to continue that even as I go on to higher level skills. Level 2, going back to level 2, sometimes there are community programs. Aqua therapy in the United States, we call it aqua therapy. It might be called something different in the UK, but it's exercise in a warm, comfortable, therapeutic pool. The warm water relaxes our muscles. The flotation takes the pressure off the joints. There's less impact when you move. So we can tolerate exercise a lot better. I've worked with a lot of people who benefited from aqua therapy or gentle yoga, not really straining to get into elaborate positions, but gently assuming some basic yoga postures with a physical therapist or a yoga teacher who's tuned in to working with people with discomfort, with limited mobility. So things like that, level 2. You're out in the community, you're doing something, you may make friendships in the course of the yoga class or the aqua therapy class or the mindfulness class. So the social comes in as well. I never know in advance what is really going to benefit the person the most. Somebody may have diabetes. There's no recipe for diabetes because one person with diabetes may benefit more from the guided imagery. The next one may benefit more from emotional journaling, writing out their emotions on paper. So we work with each person to set goals, and we find out how well those goals work for them.
And Angeli, do you find that most people do they give? I mean, Don mentioned that you can do this on your own, obviously, and you can also do it with somebody helping you. And I mean, I suppose that could actually just be a friend who's sort of keeping you answerable or keeping you on track. or to do it with a healthcare professional. Do you find that you mentioned that you've written a couple of books already for healthcare professionals? Is it something that's easily available? Generally, do doctors know about this, or is it something that people have to take to their doctor?
So yes, we did publish 2 previous books that were for professional audiences. So this is our first book for the general audience. And yes, they could absolutely start on their own. They could pick this book up and start reading, from page 1 and be able to start to initiate some of these interventions on their own, and having a buddy, having a workout buddy, that's been known for a long time, that if you have somebody that you can go out and walk with or go to the gym with, that's very beneficial. Same thing for changes in nutrition. If you have whoever's living with you, be able to engage in some change behaviors for nutrition. So absolutely. And then they can proceed. And then at some point, they may need some guidance, right? So that could be a nurse practitioner. It could be the yoga instructor. It could be a nutrition person. It could be a counselor. It could be a social worker here in the United States, that they would be able to start engaging in some simple stress management, skill building. Because we talk a lot in the book about building a skill, so having something that you feel confident that you can first learn how to do it. And there's lots of available tutorials that people can access, that they can actually learn how to do something
Mm,
that will benefit them.
mm,
And so, as we mentioned before, not everybody needs professional intervention, but a lot of people would need some help along the way. Sometimes it is an advisor, a health club would have some people that would be able to help them along the way also.
right.
So the other point I wanted to make is that, sometimes people say, well, how did you choose these particular topics? Why did you choose anxiety disorders, for example? Why is there a chapter on anxiety disorders? Because people may tend to see that as acute. So I think it's important to mention that we chose these particular topics because we see them as chronic conditions. If somebody has anxiety, an anxiety disorder, it's likely that they will have spurts of that throughout their life. They will not just have one, they'll just have one episode of a panic attack. They will have more than one, and it may reoccur during times of intense stress during their lifetime. So it's important to see what we see as the emotional disorders as very much chronic conditions. They're not curable in that sense. They are
Yes.
manageable, but they may pop up again. And,
Yes.
and the chapter on headache, actually, the reason that we wrote that chapter is because it's about relapse. So it's about somebody whose problem was under excellent control for a long time, and then so here it comes back again, which can be devastating to the person who has the condition. And but it doesn't have to be devastating.
Yes, absolutely. So I think the book sort of sets out very, very much as Don said, what the levels are. The first one is what you can do yourself, easy. The next level is really how things that you can learn, new skills that you can learn to incorporate. And the third one is quite often looking for external support, whether it be a healthcare professional, etc. And then, as you said, Angel, then we'll then look at specific conditions and how and examples. So you take a sort of an example of somebody with diabetes, for example, and how they apply their diabetes journey onto this pathways and how to improve it. And one of the things that I was very interested in, and what it explains, because with all of these things, unless you can measure it, you've got no idea if it's helping you. And I think that is really, it's very well constructed how you do an assessment. And I suppose the assessment that you're giving is the fully integrated idea, which, and I think as Angela called them previously when we spoke about it, is, you know, healing themes. What does this all mean pulled together? And so the book does guide you to how do you kick off, how do you start with assessment, and then how do you start setting, and I don't necessarily want to say goal. I mean, I know you use the word goals, but sometimes people go, oh my God, not another goal. And it's not as arduous as that at all, is it?
Well, hopefully we're starting with the simplest change, the simplest step that I can do today, something that
Yes.
does not overwhelm me.
Yes,
So
and I suppose that's the word, isn't
activity
it? Change.
at level 1, activity, and not exercise, not some heavy 10K run.
Yes.
Mhm.
And it breaks it down, doesn't it, into
Yeah,
a small amount that what could I just do today? And one day I might be able to achieve a lot, but the next day I can't achieve that, but I can do just a little bit towards it. So,
well, in our case narratives, several of the individuals that we described had setbacks, a flare of their illness, and that suddenly undermined their progress. And I think it was important for us to include setbacks because setbacks are real. That's what chronic conditions are like. They get worse, they get better. Sometimes they improve and become, the symptoms become more mild all on their own. And sometimes it's because we've been able to do something positive for ourselves. And we never know, again, those 10 areas that we assess, we never know which one is going to be the breakthrough area. I was running a pathways oriented program for pain management in a hospital several years ago. And one of the elderly individuals who attended our group disappeared. And I thought, oh, that's too bad. I did try to call her, but I didn't reach her. And I thought, that's too bad. I thought she would benefit. And then I started getting Christmas cards every year from her thanking me and saying that the last session she attended about social, about relationships, encouraged her. And she went home and called her sister, who she hadn't been in touch with, and they started getting together. And it was a breakthrough. She still had her pain condition, but her life was worth living again. And I wouldn't have anticipated that that was the area that would do it for her. But she didn't even need the rest of the class.
And I suppose that assessment, because it is quite thorough, it's got 10 points, but it's quite thorough because it does make you really think, because you yourself don't know necessarily. So it could have been your patient you were speaking to didn't really realize it was a sister that was going to be the breakthrough point, let alone you.
That's right. That's right.
Mhm. And
Yeah.
one of the things that we can point out too is that we have towards the back of the book, there's a long list of resources. Some are online resources, some are paper resources, but there's also what we call our worksheets. And for many of the chapters that have a case in them, then there is actually something that the patient can do by themselves or with a provider. You know, if they're at that point where they're working in level 3, then those worksheets also give the person a sense of this is what I need. And, you know, they may reject some of the suggestions that are made. And the chapter on anxiety disorders, that person was working with a professional, and the professional is suggesting some things like, oh, well, adult coloring can be very calming and can be almost a spiritual experience at times. And the person that we wrote about, whose name was Eliza in that chapter, she totally rejects that. And, you know, and says, I am not staying within the lines anymore. I've had to do that my entire life since I was a kid. It was always do this, do this, do this, exactly in this way. Any deviation was, you know, a source of punishment for her and a source of criticism. So when she rejects that, that's actually a breakthrough. And making that statement, I'm not staying within the lines the rest of my life, leads her to further progress where she was stuck at a certain point.
Absolutely. And I think that's actually one of the things that I wrote down is that you're very encompassing of all other resources. So, you do set down all the different apps that are available, the websites that are available, the YouTube videos. It's like you're opening. So although you give examples of things that are very tangible, one could go and have a look at, but I think you make people aware that these are things for you to go and have a look at, which would lead on to other things, isn't it? So none of it is prescriptive, but it's just opening people's minds out to all the different resources that are available, and that might be the thing that opens it all out for you.
Yes, we tried to keep it as practical, as practical as possible. And yet the interventions that we suggest, there are references to those. And in the previous two books, and there was the whole research base then was presented in those two previous books. So those books are referenced if professionals, listening to this, listening to this interview can access that information also if they need to have that strict research evidence based for what they're going to recommend.
And one of the things would be interesting as how you would recommend to read it, because yes, you'd read about how the methodology works, and then you'd say, well, I've got IBS, so I'm going to go and read about IBS. How do I apply IBS, the methodology, to my IBS? But would you recommend, and I know that I've now set you up because obviously the answer is going to be yes, but it's looking at all the other conditions as well, or at least some of them, would you suggest to read to get a real feel of what it means?
Yes, absolutely. And that leads us to the concept of healing themes is that each chapter has a concept that is not specific to that illness. So when we work with a patient, well, we've been using the example of diabetes throughout, so I'll just stick with that. When we work with a patient with diabetes, the whole conversation is certainly not about, well, what was your blood sugar yesterday? What's your diet? How many apples did you eat? And all that. It's talking about the whole person. Right. And in the IBS chapter, that one I always think that everybody should read because the people with chronic conditions, there's a level of embarrassment. There's a level of embarrassment that well, I go out to dinner with people and everybody's having this, but I can't have that. Or the person could be embarrassed because their blood pressure spikes, right? And oh, gee, I ate too much salt, or well, this is too exciting, and so my blood pressure is spiking, or I have a tendency to have low blood pressure, and therefore I need to sit down, or I have pain, or have pain. Oh, how far is that going to be? So I think that people can get something out of, I'm going to say most of the chapters, even if they don't have that specific disorder.
Yes, and I think particularly the ones towards the end when we're talking about mood or depression, anxiety, or
Mhm.
trauma,
Mhm.
because that sort of lies over a lot of them anyway, doesn't it?
Mhm.
That's right. If you're dealing with chronic pain, if you're dealing with a chronic headache, and it's going to be discouraging. There may be some depression, even though you might not have been a person with depressive illnesses before you became ill. Suddenly it's there. Or you're
Mm.
anxious. What is tomorrow going to bring? I've
Mhm.
tried to commit myself to go out with a friend on Friday. What's Friday going to be like? Is that a day I can go out, or will I have to cancel? Uh,
Mhm.
Anxiety, depression, discouragement are pretty universal when you're living with a chronic condition.
Well, then another aspect is when you receive the diagnosis. So let's say that you are being treated by a professional and you're having symptoms. So you go to the doctor and the doctor, the nurse practitioner says, oh, well, you have high blood pressure. All right. Or gee, you're developing, developing this low back pain because you have a certain condition that's affecting your back. You may need surgery. Each of these things brings an emotional reaction with that. So just receiving the diagnosis, and sometimes people go through a grief period when they receive a diagnosis. They've lost something. They've lost even something like, well, gee, I have this condition, so I really can't, at this point, I can't take those long walks that I used to take until this condition improves. And they grieve that, which is, very little discussed in medicine and medical training, that when you give a person a diagnosis, they're going to have an emotional reaction and they're going to grieve that loss of whatever it is.
And I think that's what your methodology allows you to slot into place, is to look at and examine that area, doesn't it?
Mm-hmm. Mm-hmm. We probably could write another whole book on grief. Uh, and starting out with, people start to, as they age, then they are, able to do somewhat less of what they were able to do before. And it's normal. It's normal, but it also means that they're experiencing that sense of loss.
Well, funny enough, isn't it? One of the questions was, were you planning a follow-up book? I think you've just said what the follow-up book is.
Well,
Well,
there's another one we've talked about writing, and that is for the aging process,
Oh, really?
pathways for
mhm,
achieving a really active and rewarding life in spite of the changes that come with aging.
And
mhm.
I think that's so important, because people think, well, I've reached this age, well, that's it now. Pack up shop, really, isn't it? And it's not. It's absolutely not. You
Well,
still have a life to lead.
Well,
yes.
and so many of the symptoms that we think of as caused by aging are actually caused by inactivity. When we give up our active life,
Mhm.
our bodies deteriorate further, more than they have to.
Mm,
And a
absolutely.
huge part of that is what happens to people's sleep.
Yes.
Um, as they sleep is just a huge part of having a chronic condition. All right. And then it is a huge part of what many elderly people deal with, that their sleep pattern has changed, and that's biology. That's biology. But it's also a lot of times a harbinger of future physical or emotional illness. Sometimes sleep disruption is the first sign that the physician, the health care provider, actually sees if they ask the right questions. So often that's kind of marginalized. They're taking your weight and your blood pressure and your height. Oh yeah, well, but they don't ask about sleep. They should be doing an in-depth evaluation of the person's sleep.
Mm. Yes, and I think also by looking at this methodology, because we know that when we go to see the doctors, they don't have the time to look at an integrated viewpoint of you, that
Mhm.
it unfortunately it does fall upon ourselves to be able to do that. And this allows us, you give us the method to go and look at all those areas that we may not have thought about. And sometimes people just say, oh, well, it's just my sleep. I've always been a bad sleeper, and
Mhm.
don't really understand what that means, and perhaps it's something they should spend more time looking at. So we've kind of whizzed through. I feel that we haven't done anywhere near the justice that I feel that we should do to this book, because I really was just so impressed, and I would really recommend anyone with a chronic health condition to seriously have a look at the way you're putting forward or suggesting. It's not preaching in any sense way. It is a methodology to look at all areas to go towards better well-being. Is there anything that you feel that we might have missed in our conversation that you would like to express to people?
Well, I have a couple of things that I would like to say, and one of them is a response to a question you asked earlier. You said, how well is this known in the healthcare professions. If you go to a physician or a nurse, are they going to know the pathways approach? And of course, we wish they would all read our books, read our articles, and so on. We've done a lot to promote it. I published an article in a British journal, Journal of Social Work Practice, on purpose, because I was hoping to reach social workers in the UK. I published an article in the Annals of Palliative Medicine, which is an international journal, because I wanted people working in palliative care with people with chronic conditions and even end-of-life conditions. But still, you may not, your own physician, your own nurse may not know this approach. What I suggest is read the book yourself, become familiar with the 3 levels and pathways. And then if you have a counselor that you know that you think you'd be comfortable working with, bring the book in and say, whoops, this is something, whoops, there. This is something I'm reading, and I think it would be helpful if you and I did this together.
Yeah.
If you dialogue with me, and I'll set the goals, but you can kind of hold me accountable and ask me about it as we go forward. I've had patients do that with me as a psychologist, but also in the United States, we have a lot of health coaches, increasing numbers of health coaches in most communities, or nurse coaches. And the nurse coaches, the regular health coaches can be very helpful, as can social workers, psychologists.
So what I would, what
yeah,
I would add is that I'm still teaching the medical school here, and we're bringing in more and more education about lifestyle medicine. And in the U.S., there is an organization called ACLM, American College of Lifestyle Medicine, and they have just grown exponentially over the past 10 years. Our medical school is part of the council. And so they focus on a lot of the entities that we talk about in the book, which is nutrition, physical activity, stress management, social connections, sleep, and avoidance of risky substances. So I'm teaching an elective actually to our future medical students, and we're also working with medical residents to help them prevent burnout so they can work their whole career without having to retire early because of the stress and the impact that sort of running a medical practice these days, the toll that it takes over the years.
And I think, Don, you mentioned you've got 2 things. So one
Oh,
was
yeah, the other one is really something that Angel commented on, and I'll give you another reason why it's worthwhile. If you get the book, do read the case narratives, read several of them, or even all of them. Not only are there emotional themes that happen across illnesses, but there are so many different self-care practices we describe in those case studies. And you might read the case study about hypertension, and you don't have hypertension, but the self-care practice that we introduce in that chapter might be just right for you. So that way you see a lot of different examples. How can you build your own pathway toward optimal health?
Yes, and I think that's what I was saying is, do you recommend to read a number of them? And I think that's absolutely the reason, is to find those things. So thank you. Well, thank you both very much for your time. I'm looking forward to reading your next 2 books that we've now decided. And I'm very happy to contribute toward the aging bit. Or in fact, I need to read the bit about the aging bit. That would be very good news.
That
So
one's for me too.
thank you both very much.
Thank you.
Thank you. And
Thank
goodbye,
you. My
everybody.
pleasure.
Bye.